Greetings everyone. I am Harmanat Kaur, the team coordinator of TC26 team, and today we are starting with a podcast on health and hygiene of women and pregnancy related violence, where today we have a very special guest with us, Dr. Supriya Sharma ma'am. She's a gynecologist in GMC Hospital, and we're looking forward to have insights from you related to pregnancy related violence and health and hygiene of women.
Thank you so much for inviting me for this podcast, and greetings everyone from my side too. Now we shall start the podcast, and I shall enlighten you all on the topic of menstrual health and female health in general.
So, starting, the first question that I would like to ask you, ma'am, is despite growing awareness, menstrual hygiene remains neglected. From your clinical experience, what are the most common hygiene related mistakes women make during menstruation that affect long term reproductive health?
Yes, this is very obvious that many females they are practicing wrong norms in the period of menstruation because they are not aware what is right, what is wrong. They don't have the knowledge. And the most common things which I see in my clinical practice is that whenever they come and I question them about the duration, that what is the duration for which you are using your product, like they are using tampons, they are using sanitary napkins, they are using menstrual cups. These I'm talking about the females who come from the urban population. When I'm talking about the rural population, they come and they tell that we are using cloth.
Yes.
But that is not hygienic. Even the FOXI, that is the Federation of Obstetrics Gynecological India, they also recommend that if you are using a cloth pad, you have to change it frequently. You have to wash it properly with soap and water, dry it in sunlight, and then use it again. But such practices are not seen in the women in our country.
Yes.
And even when they are using sanitary pads, it is recommended that you have to change sanitary pad after every 4 to 6 hours, whether it is soaked or it is not. And you have to change your tampon after every 8 hours and menstrual cup after every 12 hours.
Yes.
But this is not done. Females are using it for a longer time, even overnight. Overnight it is not recommended. Then they come to us with the problems of discharge, pain, itching. So this is common because prolonged use, it promotes false odor, it promotes itching, it promotes moisture, which causes the growth of bacteria. Other problems which they come with is like I'm using water when I'm cleaning my vagina, but that is a very wrong practice. You don't have to douche your vagina. You just have to clean the outer part. When you will clean the vagina, you'll destroy the normal flora, and that will promote infections. But then they say that menstruation has caused this problem, but this is not to be done. The right practice is just to clean the external genitalia. Apart from this, they come and they say that we are facing problems like itching over and over again, even after the period of menstruation. But this is because they are using tight and fitting underwears, but that is not right. They have to use loose clothes, but they are not doing so. So this is the cause of the problem, because of which they are facing problems like itching and excoriation.
Yes, ma'am. Thank you so much, ma'am. Many girls still believe that menstruation is dirty or it is something which has to be hidden. How does this social stigma translate into real medical complications you see in the practice?
Yeah, this is true that many girls they still feel, and many women, for example, the old ladies of our house, they make the junior ones believe that this is something that is not to be talked about.
Yes.
This is a social stigma. You have to hide this. You don't have to talk about this to anyone.
Especially to guys.
Yeah.
Yes.
So this is very common and it is seen in our country, in our state as well. But this leads to many problems. Girls need to understand that menstrual cycle is a normal cycle.
Yes.
It is a natural process and it is to be taken care of. Otherwise, we'll face problems.
Yes.
For example, like I told you in the previous question only, that they are using the sanitary napkins or the tampons or the cups for a longer duration, which promotes the growth of bacteria. And this growth of bacteria, this leads to alteration of the normal pH of the vagina, which promotes the ascent of infection, leading to local infections like the vaginal infections, which can include candidiasis, trichomoniasis, bacterial vaginosis. Then it can lead to infections of the uterus, which is the womb. Then it can lead to endometriosis, then spreads into the tubes, which can lead to infertility, which is very common and an upcoming problem in our country these days. It can lead to PID, which is pelvic inflammatory disease, that is the whole of the pelvis is involved, and the patient comes with severe pain, with discharge, not even settling with antibiotics. Then also, these are the problems which they face. Apart from this, there is also a psychological component to this issue. The girls, they are told not to go anywhere, not to talk to anyone. They face social isolation, they face depression, anxiety.
Even we prefer female gynecologists. And if there is no female gynecologist present, then the situation just worsens.
Exactly. They are
Yes.
not free to talk about it.
Yes,
They
yes,
don't
yes.
feel because they are not told to talk
Hmm.
about it. It is the elders of the family who have to counsel the younger ones, but they don't counsel.
Yes, ma'am. So, menstrual pain is often normalized. And how can women differentiate from a normal menstrual pain from conditions like PCOS, endometriosis, or infections?
Each and every woman needs to clarify their doubts regarding this. When we are talking about infections, in infections the pain can occur anytime. It is
Anytime.
not related to your cycle. But in menstruation pain will occur either 1 to 2 days prior to the onset of the menstruation
Yes.
or between the first to 3 days of the menstruation. So you have to differentiate the timing. And for example, in PCOS, like you said, a condition, PCOS pain, the nature of the pain in PCOS is different from the normal menstruation pain. Normal menstruation pain is cramping in nature, whereas PCOS pain is dull aching in nature. Then, if you talk about infections, it can be cramping, it can lead to acute abdomen also. It can be very severe. Then, you talk about endometriosis. Endometriosis is the condition in which there is growth of the normal endometrial lining outside the uterus. So, the pain is not associated with menstruation itself, and the severity of pain is so severe that it is not settled with normal antibiotics or normal analgesics. You need far advanced treatment for endometriosis, whereas in normal menstruation the pain is settled with normal heat therapy or normal analgesics. PCOS pain does not need anything, and infections, you have to treat the infection first to treat the pain. So all these components, they are different. And normal menstruation pain, it is not associated with features like fever or discharge. When we talk about infections, it will be associated with discharge,
Yes.
fever, chills, rigors, abdominal pain, and pain in generalized, they complain of generalized body ache. That is not seen in menstruation. That is not seen in PCOS or endometriosis. And endometriosis, it can occur in patients who are post some wound infection, post cesarean. They can also complain of endometriosis pain, but this is not so in infections. So these are the basis how we differentiate.
Yes, ma'am. Ma'am, we see that many girls and women hesitate to approach a gynecologist due to fear, stigma, or lack of privacy. What do you say to reassure them that they can seek medical help without fear or judgment?
Yeah, this is true that they have a fear in their mind that we cannot talk about this to anyone. But we need to explain them that this is a natural process which has to be talked about. If they cannot reach us, we have to reach them and we have to talk to them about this. We can organize camps or clinics to educate them about this.
Yes.
Then, for example, if we organize a camp, we can also call the family members there and we can talk to the family members to counsel the girls about this problem. And we, whenever a girl comes to us, we have to reassure her that your confidentiality, your privacy is maintained here. You can talk to us about it, and the problems which are caused because of this are very common. Every third woman in the country will come to you with some or the other problem. These problems are treatable.
Yes.
But only if you come at the right time. If you don't come at the right time, then they will create a havoc in future.
Yes.
And then there is no solution for it.
Yes, continuing to what you just said, that women seek medical help only when it becomes very severe. So, what preventive gynecologic checkups should every woman prioritize at different stage of life?
A woman's life is full of checkups, I must say.
Yes.
At every stage of life, you need some or the other help from a gynecologist or a general physician, if gynecologist is not preferable. But you have to go to them.
Yes.
If we talk about the adolescent period, adolescent is the building block of the future life. So in adolescent period, we need to take care what is the nutrition, because nutrition will decide the further build up of the female for the future pregnancies. We need to look up for the uh, education of the female regarding the menstrual health. She needs to know what is right, what is wrong, so that she can prevent herself from the infections.
Yes.
Then we have HPV vaccine. The recommended schedule is from the age of 10 to 19 years. This is very important to prevent cervical cancer, which is very common in our country. So every adolescent girl, she should approach a gynecologist. First visit should be around 13 to 15 years to look that the growth of the female is normal, all the secondary sexual and primary sexual characteristics are developing, and to guide her regarding the HPV vaccine. Then we talk about the adult females. They have to be counseled regarding the cervical cancer screening. For that, we have pap smears in urban setup, and for rural setups, we can go for VIA, which is visual inspection with acetic acid. Then they have to be counseled regarding contraception practices. They have to be counseled regarding infections, which are common. Then coming about the reproductive age females, that is mostly nowadays beyond 30 years because the trend is changing.
Yes.
So the females, they have to be counseled regarding the pre-pregnancy counseling. We call it the 0 trimester. They have to be counseled about it, that the pre-pregnancy counseling, like they have to start fall white from the pre-pregnancy period to take care of the complications which can occur in the pregnancy period. Then they have to be counseled that they need to continue with their cervical cancer screening. As I told you earlier, pap smear is recommended to be started around 21 years and done every 3 years, or we can go for HPV DNA testing, which is to be done every 5 years. Then coming to perimenopause and menopausal age group, they also have to continue the screening, but only until the age of 65 years. Be it that the prior tests, they all are normal. Apart from that, breast examination is very important, which is to begin from the reproductive years itself, continuing in the perimenopausal and the menopausal age group. In these age groups, we recommend mammography, which should be done annually. Apart from that, as menopause is associated with the loss of calcium and vitamin D in the body, so we recommend them to go for calcium or vitamin D levels or bone scans, which is the DEXA scan, which may be done.
Okay, ma'am. So many women remain unaware of health and sanitation schemes, particularly which are particularly meant for them only. So what schemes and government initiatives are there that can play an important role in hygiene and sanitation that women actually should know?
Well, I must say Government of India has launched a lot of schemes and many people are not aware of it. They are not using it. They are not taking the advantage.
Yes.
Government is doing everything, but they are not able to take the advantage of it. To talk about, let us start with Swachh Bharat Abhiyan. In Swachh Bharat Abhiyan itself, they have the provision of providing incentives or money to make household toilets, which is the basic part of hygiene. But many people still don't know. They don't know. They just know that Modi ji is giving some money to construct a house, but they don't know how to get that money, which is the source of that money.
Procedure of getting that money.
How to get that money. And even if they use that money, they built a toilet, but still many women, they are not using it. So what is the fun of that? We have Swachh Vidyalaya program under Swachh Bharat, which is that in each and every school, toilet is compulsory. If it is a co-ed school, separate toilets for girls, separate toilets for boys, but that is also not done. And apart from that, we have menstrual hygiene scheme, which is launched by the Government of India. Under that scheme, it is the government is trying to provide safe and affordable sanitary pads to all the women in the country at an affordable price. That is through the ASHA workers. They are doing it. They are providing them packs of 6 pads each, and the total cost is just 6 rupees. Apart from that, they are also providing sanitary pads known as the Suvidha pads through the Jan Aushadhi centers. That is also for ₹1 each. And in some states, they have started the initiatives of providing free pads to the schoolgirls. For example,
that is happening in Jammu Kashmir as well.
And for example, if we talk about this has started in Jammu Kashmir recently, but it has been already there in states like Orissa, in states like Bihar, in states like Arunachal Pradesh, in states like Haryana, where they think the hygiene is more compromised. In Orissa, they are running the Khushi program, which is that in the school premises itself, they are providing free sanitary pads to the girls from the 6th to 12th standard girls. They have a pink room in the school itself, where they have a pad disposal machine and where they have a vending machine and a disposal machine. Disposal machine, they are using mini incinerators. Many such schemes are there. These are some of the common ones.
Yes, ma'am. So if you had to highlight one of these, all the government health or hygiene schemes that every woman should be aware of, what would it be? And why is it medically so important that you had to highlight?
Okay, well, it is difficult to choose one, but if I have to talk about one, it will be Janani Suraksha Yojana. You must have heard about it, JSY. It is being run in Jammu itself. According to this scheme, government is providing incentives to the female so that they are attracted towards institutional delivery. Money is given so that they are attracted, and it actually happens. People do come to us in hospital and they say ki hamari to delivery yahan hui hai, we need money for that delivery. Modi ji is giving some money for that, and this is working. It is actually working. So everyone should know about this. Every woman should know about this. It's the right of every woman to know about this, that she needs a safe delivery, not home deliveries. And if home deliveries, then with a trained birth attendant, not unattended deliveries. This is done so that we can reduce maternal mortality, which has reduced to some extent in our country, but still the rates are alarming, and to reduce the neonatal morbidity. Because if institutional delivery is done, all the services are available at a single center, which can be used to tackle the situation if any problem arises. And
Yes.
also in the same institution we have the care for the newborn also,
Mm.
so the newborn health is also not compromised.
Yes.
Under this scheme only, government is providing incentives based on the performance of the states. States, they are divided under low performance states and high performance states. Our JNK itself is in the low performance state.
Mm.
In the low performance state, they have divided the areas into rural and urban. After every delivery in an urban area, they are, that is an institutional delivery, they are providing rupees 1000 to the female. And in rural area they are giving rupees 1400 to the female. And when we talk about high performance states, there they are giving rupees 600 and 400 each. Also, they have linked ASHA workers with this scheme. They are told to get the female enrolled as soon as they come to know that they are pregnant, and it is their initiative. They come to the females, they take them to the Anganwadis or the CHCs or the PHCs or district hospitals to come for regular checkups, to take the supplements which are freely provided by the government, and it is their responsibility to look after that they get the incentives after delivery.
Yes.
They are also given money for this.
Ma'am, that is some brilliant information that we got to know about this particular scheme. So, do you observe differences in how women in rural and urban areas benefit from government health and hygiene schemes, and what gaps still medically exist and they exist in structure as well?
Yeah, definitely there's a lot of gap and it needs to be filled as soon as possible. There's a lot of difference when I talk to females coming from the urban population and the females coming from the rural population. The urban ones, they are well aware of the schemes. They have easy access to infrastructure. They know what is right, what is wrong. They are not so much influenced by the social norms. The taboos, they are less in the urban society.
Yes.
But when it comes to the rural area women, they come after facing the problem for like about 2 to 3 years. And when you ask them, where were you? Why didn't you come earlier? And they approach only when the problem has risen to a severe extent, then they come to us. And when they come to us and we tell them that even in your local areas, you have Anganwadis, you have CHCs, you have sub centers, you could go there, you could ask them. They say, we don't know. Nobody comes to us. Nobody comes and tells us that we have a free approach to all these things. They don't know about it.
Yes.
So yes, there is a lot of difference. And even when they face the problems, reaching to a particular facility to take the benefit of it, it takes a lot of time for the rural population. Some of them, they come and they say that we started our journey 3 days back, and they reach to us after 3 days. Till then already the condition has worsened. So this is not now, this gap needs to be filled as soon as possible.
So, from your experience, what is the single most overlooked aspect of women's health and hygiene that deserves urgent public administration?
Well, the most important factor which is leading to a compromise in the health and hygiene of the women is the lack of confidence, the lack of freedom to speak.
Yes.
They are not able to speak about it. They need to know that this is normal. They have to normalize this condition. They need to know that all these problems which are occurring, they are faced by more than 90% of the females in the country. They talk about it, they come forward, they seek treatment, and they get treated to live a healthy life. So this lack of confidence, this needs to be corrected, and this cannot be corrected alone only by the healthcare workers. This has to be an initiative taken by the society also. The men of the house, they have to take care about it. They need to tell their women to come forward and talk about it, so that they can look after the family well. If they are healthy, then only the family is healthy. If the woman is suffering, then the family is suffering.
Yes.
So they need to talk about it to their females.
Absolutely, ma'am. So, in many families, we see that deeply rooted myths are there, such as judging a baby's sex based on a pregnant woman's appearance or glow, which lead to pressure for selective abortion when a girl child is suspected. So, if a pregnant woman or her family approaches you in such a situation, you or any other doctor, what legal protections and laws come into play to hold these exerting pressure accountable?
First of all, there is no definitive method of determining the sex of a baby based on the appearance of the female or the food preferences of the female or any other changes which they see in the pregnant females. Apart from that, in our country, we have very strict laws for the determination of gender. We are not allowed. We have an act known as the PCPNDT Act, that is the Preconception and Prenatal Diagnostic Testing. That act clearly states that determining the sex of a baby before birth is a crime. You cannot determine, no doctor can tell it to the attendant, either directly or indirectly, and no gynecologist can practice abortion based on that determination if it is done. This act was itself created because earlier in our country the rate of female feticide was very high, but now it has dropped. So practically in today's time it is not possible to determine the gender of the baby before birth. But still, if, like you said, in some situations, maybe somewhere, some places, it is being done, then this is punishable. This is accountable for punishment. The gynecologists, they can face severe punishment. So you have to tell them that this is an offense, and I am legally protected. I cannot tell you, neither a radiologist can tell you. And even if you come and force me to do such thing, you are also liable for penalty. You're also liable for punishment. I will report to the police if you force me to do so, because legally this is stated that this is not to be done. If I do so, even after knowing that this is a crime, I can be punished. I can face suspension. I can face permanent deletion of my license. And if a radiologist does so, he can face penalty in the form of punishment, imprisonment, or fine. So everybody has to take care of it, and they need to know that this is a law, and legally we are not allowed to do this.
Okay, ma'am. So, when we talk about pregnancy, we cannot ignore unwanted pregnancy. So, in cases where young women or girls try to hide an unwanted pregnancy due to fear or stigma and resort to unsafe home remedies or unregulated pills to induce abortion, what are the serious health risks involved, and what safe legal options and support systems are there that they should be made aware of so that the fear does not push them towards life threatening choices?
This is a difficult situation. Whenever such a patient come to you, you have to handle that patient with compassion. You need to tell them that safe abortion is legal. We have the MTP Act in our country, which has been recently amended, and it states that safe abortion is legal if it is done in even married or unmarried females, in adolescent girls, in survivors of some rape or other assault, or if there is a failure of contraception. They need to be told about this, that safe abortion is legal, not based on the gender discrimination, but safe abortion is legal. So they can come to us and we can tell them that this is legal, you don't have to worry about it. No need to go for unsafe methods like using home remedies or using pills without the prescription of a doctor. You need to come to a doctor and you need to tell them that this is a problem, we cannot keep this baby, so we have an option of safe abortion, we can go for that. Apart from this, and the most important thing is that no consent is needed, only the consent of the patient herself is needed. You don't need to take the consent from the husband, you don't need to take the consent from the family members. It's just the consent of the pregnant female itself.
Yes.
But the situation is different when it comes to adolescent pregnancies, the females who are less than 18 years of age. In that cases, if such happens, they need to be accompanied by a guardian, because we need the consent of a guardian. And if so, there is not any guardian available. First of all, a pregnancy, whenever we come to know about a pregnancy in a female less than 18 years of age, we have to report about it, because this comes under the POSCO Act,
Yes.
which is the Prevention of Crime Against the Children Act.
Yes,
So we
sexual
have to
offences.
report
Yes.
about this to the nearest hospital or the MS or the nearest police station, because this is considered to be a sexual offense. So this has to be reported. So first of all, we have to do the reporting. If the child is feeling unsafe, we need to involve the local police or the child welfare committees in this. And if no guardian is there with her along, then also we have to inform the child welfare committees to come forward and look into the matter, because we need a consent
Yes.
in case of females less than 18, be it from the guardian or be it from the child welfare committee. So this is important, that they should know that whenever these pregnancies are there, we have to inform. Informing is must. And you're not informing because you want to harm the girl. You are informing because you want to protect the girl from any danger. We have many helpline numbers. You can call on those helpline numbers to seek help if there is any problem.
So instead of resorting to home remedies, the girl should
Approach a
inform.
gynecologist.
Yes. So finally, with the last question, I would like to ask you that if you had to give one message to women and girls listening today about health, hygiene, and self-respect, what would it be?
Well, this is a difficult question, because message is a huge thing which I need to give to the female. But to summarize, I can say that I will tell each and every female to prioritize yourself. You are important. Take care of yourself. If you are healthy, your family is healthy. Because your body is important, you need to pay heed to the changes which occur in your body. You are important. You are the creator of life. You have the capability to give birth. So take care of yourself. And the thing important is that when you will respect yourself, you will learn to respect others. So you have to take care of yourself.
Yes.
So learn.
Yes.
You need
Also,
to
we
learn.
have so many remedies available
Yeah.
through the government initiatives.
Yes.
Why
So they
not
need
use
to
them?
learn, they need to
Yes.
ask, they need to practice so that
Hmm.
they can empower themselves.
Yes, yes, ma'am. Absolutely right, ma'am. Thank you so much, ma'am, for
Pleasure is all mine.
yeah. Thank you so much, ma'am. We are really grateful, and on behalf of my team, whole of the members of our team, I would like to express my gratitude to you, because today's information that we gained today, it was amazing and well needed in these related topics. It is well needed, and I hope that all the audience that will who were listening to us, I hope you got some insights and knowledge regarding pregnancy related violence and health and hygiene of women. Thank you so much for joining with us.
Thank you.
Thank you.